Okay, looks like we are live. Awesome. All right. Well, welcome everyone to the safe space where we learn how to train, feed, and now heal our dogs more naturally. And today I have Dr. Jones, veterinarian. Many of you probably recognize him. He's all over the internet. I'll have all his information linked below. And we're going to talk about this relatively new mystery illness going around the country and even up into Canada, we were just talking about the latest updates. What should we be worried about? Should we even be worried? How to potentially keep our pets safe? So let's just jump into it, Dr. Jones. We already have 100 people in here, and I think it's going to grow quite a bit. First off, thank you for being here. I'm really excited to have you to talk about this really important topic.
Awesome. Well, first, thanks for having me. And I fully agree because I'm getting so many questions specifically on this topic. And just like myself being a dog parent, what do I do? Like, how serious is it or not?
Mm-hmm.
And like, what should I do to protect my dog? Should I vaccinate him or her or not? Or should I give some home remedy? So yeah, it's great that you're doing this live stream now.
Awesome. Yeah. And I know that you've been following this for actually a long time now. You're in the seminars, you're doing a lot of the research, which is why I was so eager to bring you on. So I want to jump in and ask right away is really how worried should we be? Like, is this just media blowing this respiratory illness disease up into something that it's not and something more serious than it is? Or should we actually be pretty concerned with our pets and their safety right now?
So it's a good question. And when I first read about it, I thought, oh, it's more likely it's like some type of kennel cough that's maybe slightly mutated, and maybe there's more media coverage than there needs to be. But since I've been just gotten more involved in terms of understanding more of the cases and seeing more of the referral centers that are seeing cases of these dogs that have this unknown respiratory disease, I would say yes. I would be definitely on the sort of more concerned side. For sure, I definitely don't want my dog to be getting this.
Okay. So I guess my question to you, let's start a little bit at the beginning, because I think this video is going to be a resource for many pet parents who are kind of just hearing about this or want to learn more. So can we start off by what is this to the best of the knowledge of your knowledge? I know we don't know, but what do you suspect this is? Viral, bacteria? Is this just a super kennel cough that we're worried about? Or what do you suspect?
So we know, so part, like even backing up a little bit, just to know that there is a serious disease going on. Some of the referral centers and then universities have been able to look back and see how many cases of pneumonia have they had. And they were comparing sort of this fall, kind of August, November, September, sort of this fall compared to the previous fall. And so in some areas, such as in Colorado, Oregon, they've seen almost like a 50% increase in the number of dogs diagnosed with pneumonia. And they've also seen, in some cases, some of the pet insurance companies have said there's been increased claims for pneumonia in Canada. So based on what some of these veterinarians are seeing, they can say, yeah, this really is this real emerging disease. Next, you're asking like sort of what do we know about? So we know it's much the same, similar to kennel cough in terms of this infectious respiratory disease. Think about us having the flu or the cold or flu. I mean, many people sort of wondered, is this dog COVID? Which similarly was a respiratory disease, had much of the same signs and symptoms. So if any of you have ever had a dog with kennel cough, I mean, it's a dog who all of a sudden he just has this throaty, deep cough, like he just can't start coughing. It almost seems like he's trying to throw something up as if there's a little bit of phlegm and nothing comes up. And that's called infectious tracheobronchitis. So it's just inflammation of the trachea, the main part of the throat. And then as it starts to go lower down towards the lung, that's the bronchi, called bronchitis. So that's often how this same disease starts. Like you get these dogs suddenly coughing. But then in Some dogs, and they're not sure how many percent, some will keep coughing for a period of time, but then they can develop a pneumonia.
Mm.
And when your dog has pneumonia, he's going to have, so he's not just going to be coughing, he's not just going to have a runny eyes, he's not going to be sneezing, have a runny nose. Those are kind of the classic signs of us having a cold. Then think about something more like the flu, where then he's going to be lethargic, he's spiked a fever, he all of a sudden his appetite's going to have gone down. He just because you don't have the energy. So as you can imagine, you need your lungs to be working so you can breathe in air and then get oxygen to your red blood cells. And if you have all this inflammatory cells and infection within your lungs, they can't do that. You're breathing in air, but you just can't get oxygen into your red blood cells. So that's why these dogs all of a sudden not just lethargic, they might be breathing really labored, or their breathing might be fast, and you're going to see it. You'll see their chest really. Sometimes this marked movement of their chest, or other people notice abdominal breathing.
Wow. And so, okay, so we know that this is highly infectious, contagious. How are dogs getting this? Is it just that we know of, right? It's still developing, but is it
Yeah.
primarily nose to nose? Or there's a comment by Hallie here, can you, or somebody asked, can you get it from sniffing soil and sniffing grass, things like that?
So what's known now is we know it's this infectious respiratory disease. Likely you've got these airborne droplets, um, similar to how the main primary way that say COVID was infectious between people. So you have these airborne droplets. Because they don't know the underlying cause, they can't say, can it survive or can it survive in the soil? Can it survive on someone's hand? No one knows. But for many of the viruses and the bacteria that cause kennel cough, they're much more of a direct contact thing where someone sneezes and there's all these thousands or millions of airborne virus particles. And then your dog is in close contact, you breathe it in. And that's how they're getting it. And the other big thing to add, though, is the infection rate of any of these infectious airborne diseases is much higher in a small space. So, for instance, being outside in a big trail, you pass another dog in a trail. Could you get it from that dog? You could. Chances are fairly small unless they stop and they play and one dog coughs or sneezes. But it's much more common in a small setting, like a kennel or a dog daycare for instance, where it's a confined space. You're gonna have millions of virus particles circulating in a small area.
Mm. So, is our biggest concern here that if our dog gets exposed to this, that they could develop pneumonia? Is that the potentially scariest part that could lead potentially to fatality?
Well, it is, and as we were just saying earlier, I was reading a report from a veterinarian who's a
Mm.
specialist at Texas A&M, I mean, they've been treating multiple dogs with respiratory disease. So they're coming in coughing. Most of the dogs then end up at a clinic or much sicker. Like they have developed pneumonia. And they've been doing testing, trying to isolate, like figure out what is the underlying organism or cause. And they say in about a quarter of the dogs, they haven't been able to figure out, they've got some type of infectious respiratory disease, but they can't figure out the underlying cause. But with this one veterinarian was saying, her own dog started coughing. Sort of a day and a half later, he spiked a fever. And that was all of a sudden, then he spikes a fever. He's not moving, he's not eating. And this
Mm.
is a golden retriever. And it's starting to show signs of maybe difficulty breathing. Maybe even the gums can be a change in color. They might be slightly blue or cyanotic. So that's an example of a young, healthy dog should never develop pneumonia, especially from kennel cough. And to see that happen in a few days, and that is the big concern. You're seeing the essentially healthy dogs getting exposed to this and developing pneumonia in a short period of time. But we don't know. It sounds like the majority of dogs who get exposed to it, they have a cough. They're not going from cough to immediate pneumonia to veterinary hospital.
Mm. It's really scary. And it sounds like the biggest risk for our pets, obviously, is exposure. As you said, in smaller confined spaces like doggy daycare, dog parks, boarding. The problem is, and I'm sure you've seen this on your socials quite a bit, and again, for those of you that are joining from my channels, all of Dr. Jones' links and socials and website will be linked down below for you. But right now with the holidays, a lot of people planned weeks or months ago to board their
Mhm.
dog. And now they're kind of panicking, like, well, what do I do? I have this trip I'm going on. So, I mean, I guess to summarize my question, how is a pet parent who maybe doesn't have a lot of options to avoid these dog group areas, like what can we do to keep our dogs safe?
Safer. First, some of the kennels are better. They'll have air circulation system. So that instead of you have just one air intake and that's essentially one dog coughs and it goes throughout the whole kennel. So just ask how they're dealing with airflow. I know when we had an animal shelter, we were able to modify the airflow so
Mm,
we could slightly isolate animals. Um, Second would just be whoever is staffing that kennel, just how diligent they are around. Like if there's any sign of respiratory disease, like if there's a cough or a sneeze or runny eyes or nose, like that dog has to come out of the kennel. So he's not then infecting other dogs. So part of it would be that. And obviously the biggest thing, I mean, would be ideally just not having your dog go there. But
yeah.
that's as you said, like for a lot of people, you don't have an option. So just ask a few other questions of the kennel and that they're obviously aware of it and are they really, really on it? Like there's even a sign of anything respiratory, that dog is out of that kennel and in some form of isolation. And do they have that option, right, to isolate a dog if they need to?
Yeah. I think a lot of people are able to find other options like in-home pet care and things like that. Or some people I know have even canceled their trips to stay home
Hmm.
with their dog. And, I think that can be justified. I think everybody has their own level of worry. I know I did a poll on my Instagram and I asked people how worried they were. And most people were very, very worried. For me, I'm kind of middle ground. I'm worried. I'm just not panicking. But I'm also blessed that I get to work from home and my family is in my town. So I don't have to travel for the holiday. So I'm very fortunate and privileged in that. So, and I think a big thing we could also talk about in a moment is what we can do to boost our dogs or support our dogs' immunity so that if they do get exposed, the likelihood of getting severe symptoms are less. But before we get to that, what would you say to pet parents that are being told by their local veterinarians that to keep their dogs safe, they need to come in right away to get a Bordetella or kennel cough vaccine, the influenza vaccine, and make sure they're up to date on all of that. What are your thoughts on that?
Um, Good. So I'll speak for what I would do with my own dog. I'm not
Yes.
going to go get her up to date with kennel cough and or other kennel cough complex vaccines, in part because from the number of different dogs that have got this disease, it's not as if they've said, okay, there's less. Most of these, the bulk of those dogs have had vaccines, have already been vaccinated. It's not as if they haven't had vaccines and they're getting it. And when you're dealing with a brand new disease, I mean, it's similar. Just because we're vaccinated for, a flu strain of a viral flu strain, there's a number of different viral flu strains. So because you have one vaccine does not mean it's going to be protective. So that's partly my thought. Partly my other thought is that you are taxing your dog. You're asking things of your dog's immune system when you do give a vaccine. And if your dog is not going to a kennel and maybe you're modifying how you're still walking your dog, but you're not doing it. You're avoiding the busy dog park. You're avoiding the peak times when they walk on a trail. Then you've already minimized your dog's chance of exposure. So you have to make your own personal decision. Obviously, what you feel is best for your dog, but that's what I'm choosing. I'm not doing it.
Yeah,
So
no, I love how you worded that. And I forgot the disclaimer at the beginning that everything shared here or nothing shared here is to diagnose, treat, prescribe, cure anything. Always work with your local veterinarian. Dr. Jones
yes.
is just sharing based on what he would do for his pets and as well as me just sharing what I would do for my own personal pets. And this is a good resource though. This video, it will be published to watch on replay later would be great to share with your local veterinarians, because I am seeing a really big push to get these extra boosters or vaccines. And I'm not anti-vax by any means. My dogs get all of their core vaccinations, but I too do not give them the Bordetella or the kennel cough or the influenza now or in the past,
Mhm.
mostly because I just don't see the benefit. And there's so many strains of kennel cough, as you alluded to, that I've, especially in rescue work so much, I've seen dogs that have all the vaccines and they still get the illnesses. So just the risks did not
Exactly.
outweigh the pros.
Yep. And that's what I have seen similarly.
Yeah. And I don't know, do you know how many in the US, at least how many states it's in? I read something this morning that said it was up to 37 states are seeing what they think that this is, whereas I feel like a few days ago it was 14. I have to
Right. That's
fact check
right.
that.
Yeah.
Yeah. Oh my
Yeah. I
gosh.
read the same thing. I read
Okay.
initially 12 or 14, and then I read
Wow.
uh, closer to 30 to 40 states. We were going through because I originally published a video on YouTube specifically about this mystery
Hmm.
dog disease. And going through, we had over 5,000 comments. And going through the comments,
Mm,
most US states were represented in the comments. Um,
wow.
and the hard thing though is because there isn't a test for the disease. So you have a dog that's acutely coughing. I think it's kennel cough complex, and he develops pneumonia but doesn't respond to antibiotics. That's sort of been the sort of when someone's calling it mystery dog disease, that's what they're seeing. And these dogs getting acutely sick. A bunch of them had to be on oxygen. Some have had to have these nebulizers where they have a face mask.
Mhm.
And if you've seen sort of asthma puffers, they might be getting something to help dilate their airways. Um, all those secondary treatments. But the point being, I think you're more likely right. It's probably closer to 40 states, or the bulk of the U.S. states.
Wow. It is scary. And I think it's something that it's important, like I said before, to stay informed on and updated on. And I know you post about it frequently. But again, for me personally, I'm not panicking. I'm still, you said this earlier, but I'm still taking my dogs for walks. I'm still letting them sniff. I don't do dog parks, of course, but I do avoid popular trails, popular areas where dogs frequent. And our older or previous sniff walks are definitely shorter. It's more getting them active, because I feel like, and we'll talk about immunity, but I know that giving our dogs ways to alleviate stress and to get their body moving and exercise is really important for overall health. And I get a lot of comments of people saying, I'm not letting my dog go outside unless they need to go to the bathroom. I've stopped walking them. We're not doing sniff walks. And that worries me, because I feel like that's so far extreme that our dogs could end up getting, mentally, they could
Mhm.
mentally suffer a bit and physically start gaining weight. And then their immunity is compromised. And that's, in my opinion, would seem like it would expose them more or put them more at
So
risk.
yeah, so good point, and I'm probably along a similar line. So and the other thing I might add to that is just knowing what's happening in your area.
Mm,
So obviously, if there's like this giant outbreak, because there's certain areas I know that say, for instance, parts of Colorado, parts of Oregon, where there really
mhm,
was, and some areas had quite substantial outbreaks. Well, then that's a good time to be extra cautious. But for the bulk of the times, I'm much practicing much the same way you suggested, Rachel. As far as obviously, I still want to walk my dog. Like, exercise is pretty important, as you said, partly just for mental health, but also just as you said for just general immunity. Right, when you're like physical exercise, along with some other supplements we'll probably talk about, it is important you're still be able to keep some of those routines, but maybe, as you said, sort of modify some of the stuff. So you, as you said, avoid the busy times, avoid the really busy dog parks, and as you said, maybe a little bit of a shorter walk or a walk that's more exercise focused and less meet and greet.
yeah, definitely no nose to nose greetings or sharing communal water bowls or things like that. Do we? I know that. Okay, I was trying to find the number of fatalities. Everything I read, though I haven't dug a lot, has said a few. Right. So, do you know any of the stats on that? If there's
There's nothing published.
okay,
Just if you look at the few articles that have come out, they've said there's been X hundred. there's different numbers published by different states,
Hmm.
but no one's published number of fatalities. Some of the referral centers have said that, they gave the example of seeing 100 animals and seeing 6 or 7 of those animals, those dogs, have died. So, I mean, that's still looking at, somewhere as a 5%, which is
Right.
substantial. Like that's, but that the referral centers, they're seeing it dogs that are quite sick. So most of us would have a dog that's acutely cough, all of a sudden starts to cough. And sometimes the coughing gets worse, like, oh, this seems a lot worse than kennel cough. And then as long as your dog is still eating and drinking and doesn't seem clinically super sick, at least that's what I do with my own dog. I wouldn't rush off to the vet right then, because most likely that's what you're dealing with, one of this kennel cough type diseases. Maybe it's this mystery disease, but as long as he's still eating and drinking and not seemingly ill, still has energy.
Mm.
But it's when the cough progresses and it's not, and all of a sudden it's every sort of 30 minutes, and your dog all of a sudden just doesn't, is really starting to, energy starting to flag, then right, that's when you need to be seeing your veterinarian and or taking a little bit more aggressive action.
Mm. Yeah, and we have a comment here that with the Asher House, which is not too far from me, and I'd have to fact check this, but 80 dogs had several come down and only one fatality and stuff. So I think we're seeing a lot of um, where dogs are in close quarters, get it, and then minimal
Yeah.
fatalities. So, okay, so let's talk about probably, in my opinion, I'll say the most important thing, which is setting our dogs up for success, supporting their immune system. Because if our dogs are strong and healthy, if they do get exposed, the hope is they would have less risk of getting severe symptoms or clinical signs. So, what are some of the things that you're doing with your pets? I know that you've shared this before, but love to hear what you're doing to keep your pets safe in terms of boosting or supporting their immune system.
So with my own dog, I mean, and I think with most of you, I mean, obviously the main focus is diet. So I'm not, everybody's got a sort of a slightly different take on diet, but just making sure you're providing all the nutrients that are more dog or species appropriate.
Mhm.
So you're minimizing carbohydrates, potentially minimizing the amount of kibble. Most of us still feed kibble, and if you're feeding kibble, you're feeding a better quality kibble that is higher in protein, higher in some of the good additional vitamins, minerals, higher in some of the beneficial fats, but lower in carbohydrates, because we know that's definitely not beneficial. That gets converted to the simple sugars. And then with my own dog, she still gets, I make some form of homemade diet once or twice a week, along with, and I actually also still feed her some raw food, which she's very excited about.
Of course.
So that's kind of the principle is diet, and the next part of that is then there's a few different supplements I add in. She regularly gets an essential fatty acid supplement, because if you look at all the different range of benefits, one of them is just immune support. Um, the other big thing, general thing I give, and then we have our own. I have my own
Mhm.
veterinary sort of formulated supplement that includes ingredients that are beneficial for the immune system in terms of colostrum, in terms of 95% curcumin, along with some of the different antioxidant and vitamin and minerals.
Yeah. So going back to kibble, like you said, many of us are still feeding kibble. Would you say it's beneficial, especially now more than ever, just try to add some healthy, kind of fresh food, whole food, less processed toppers, like no salt added canned sardines, things like that?
Yes, and just starting, definitely just starting smallish first to make sure that there's no GI
Yes.
upset, as
Yes.
you probably experienced with your own dog.
Yes. Oh, for sure. And, it's so popular on social media right now with these meal toppers and all these treats and supplements we can add to the bowl. And I think right now, especially, people want to know these full lists of all the things to add, and they start adding it at the same time. Then their dog has loose stool or upset stomach. And I think that I'm so glad you said that like, anytime when I was feeding kibble and I would add new things, it was one ingredient at a time for like several days and then slowly add a second one just to see how they digest and handle that.
Yeah, that's actually good. That's a great suggestion.
Yeah. So one of the things I like to do, and I'd love your thoughts on this. So I had read that lungs in our dog, or I guess humans as well, are one of the, or if not the first barrier to pathogenic invasion. So I've really been thinking about, okay, how can I protect my dog's lungs? So some of the things I'm doing in my house or have done already that I think might relate to a lot of people is like, and you've talked about this before, removing as many items in my home that have scents, like especially holidays. Everybody has their pumpkin candles, their Glade plugins, the Febreze scents, the lotions, the hand soaps that smell like cinnamon, because those are full of VOCs or volatile organic compounds, which are irritants to the respiratory system, from what I've learned from people like yourself, doctors like yourself. And that can cause inflammation, hormone disruptor, and ultimately potentially weaken the respiratory or lung system. Is that an accurate statement?
Well, and what just as you're saying, so anything any potential toxin you're gonna
Mm-hmm.
inhale, then I guess going down your dog's trachea into his small airways, into the
Mm-hmm.
fine airways, the alveoli, and right, and if you can imagine, they're sort of microscopically thin because that's where oxygen has to be moved from in the airway, that smallest part of the airway, into the red blood cell, transmitted to the blood. So these microscopically thin little pieces of tissue. So anything potentially toxic, right? As you said, like the plug-in Glade, for instance, or some of the stuff that might be off-gassing in your house. Someone's just
Mm.
put some new coach, which someone where many of the companies they'll add in fire retardant chemicals that will then off gas, for instance. So that's a that's a really good suggestion. Other things such as wood smoke or anything as you just talked about burning candles and right, all of a sudden your dog has to like filter that.
Yeah, and I also have an air filter, and this isn't just because of this. I always do that, but I remember reading once that from the EPA that indoor air quality can be 100 times worse than outdoor air quality. And then if you think about our dogs, they're inside our homes, most of them at least, more than we are. We might take them for an hour walk, but most of the time, otherwise, they're inside. And so I'm like, wow, like how can I make sure I'm not using toxic cleaners or floor cleaner, especially things like that. So that's kind of one of the things I thought about. Even opening my windows, this might be like, a little not extreme, but maybe not super related, but I like to get fresh air even in the cold of winter. And even if I can only open the windows for like a half hour, just to let fresh air go through the house, to me, I think is just really
Hmm.
important.
Yeah, that's all good points. That's
Yeah.
good. Yeah,
Okay, good. I'm glad you like that. And I
yeah, no,
agree. Oh, go ahead. Yeah, go ahead.
yeah, those are good suggestions.
Yeah. And I agree with you on diet. Kind of how I always think about it is just feeding the freshest that we can afford sustainably. And so, like for me, similar to yourself, I'll feed like a raw or gently cooked diet. And I love that you brought up lower carbs, because I think that's something that even if you're feeding a kibble, we can reduce the amount of carbs, like you said, by feeding a higher quality kibble and or replacing some of that kibble with pet safe whole fresh foods. And that's really important because as you have taught us over the years, excessive carbohydrates can lead to inflammation in the body. And if our goal is to keep our dog's immune system strong, I feel like that's really important. What about mushrooms and medicinal mushrooms? Is that something that you find to be valuable for immune health?
Well, starting to use definitely, maybe starting to use more of those more often for some of the immune diseases that are going to need immune support, i.e., especially some of the cancers, for instance.
Mhm.
So, I mean, there's a number of different medicinal mushrooms. Turkey tail, for instance, is one of the mushrooms which has been, of all the different medicinal mushrooms, it's one of the ones that's been more studied. And to the point now where, I mean, it's recognized in Japan as medical treatment for certain types of cancer.
Oh,
So
I
if you
didn't know
look
that.
at some of the regimens, so they're still doing chemotherapy, and these are conventional physicians using it, where they're doing chemotherapy, they're doing radiations, for instance, say for chemotherapy for colon cancer, but then they would also add in this mushroom turkey tail. So they're great options, whether you use a combination mushroom extract, because there's a number of different ones. Because you have turkey tail and you have lion's mane and you have maitake, you have cordyceps. Like there's a number of different medicinal mushrooms. Chaga is a great one as well.
Mm.
You can get these medicinal mushroom combinations. Those are good additional options for sure. If someone's wanting to add something into their dog's diet to potentially give them that extra little immune support. Um, the other one thing I just want to add, Rachel, because I did forget to mention we were
Yeah.
talking about these. So I don't want to interrupt your flow, but
No.
some of the other things when I was doing even more research just for this live stream is that in New Hampshire, one of the referral veterinarians they've likewise got diagnosed some dogs with this mystery disease, and they've claimed to isolate a bacteria as they're claiming to be the underlying cause. They haven't named the bacteria, and they said it's a normal bacteria that's often found in a dog's intestinal tract, that somehow it's mutated and causes disease. But that's just a small number of cases in one part of the US. So that's one. Maybe it is a bacteria that's mutated. Makes sense. As a possibility, it's hard to know. Is it virus or bacteria? And the other thing I did want to add is a number of people, even when I did post that first video on YouTube, had said that when their dogs were in veterinary at referral centers being treated for this disease and they developed pneumonia, the one antibiotic they responded, there's an old antibiotic called chloramphenicol.
Hmm.
So it's an antibiotic that it's quite old. I mean, it was sort of being phased out in veterinary practice when I started, and that was a long time ago. Um, but it's a broad spectrum antibiotic that works against majority of bacteria for intestinal bacteria, urinary tract infections, soft tissue infections. It would be used, but it can also work against bacteria that grow where there's no oxygen called anaerobic bacteria. It also seems to have some like anti-protozoan qualities, so it's got this wide spectrum. The concern using this antibiotic that in cats especially, but in some dogs, it can affect their bone marrow and they can develop anemia. So that's why it's sort of been phased out.
Mm.
But that being all said, if you've got a dog with serious pneumonia and your veterinarian is suspecting like this is the underlying cause, it's this mystery dog disease, that's an antibiotic they probably should consider. And I think most vets are aware of it, but maybe not all are.
No, I don't think. Is that the one where you have to, if your vet prescribes it, you need to wear gloves? You don't want to touch it.
That is all true, and it should be said that. Oh, like I know when I was first in practice, I mean, we would readily dispense it, and no one would
Oh,
know
goodness.
gloves. It was these big purple pills called chloramphenicol, and so yes, you should all be extra cautious, and you should wear all that, right?
Yeah.
Because the last thing you want is your dog gets better and you get and become
and
aplastic.
then you get sick. So,
Correct.
and that's kind of a good segue to a question is, okay, so and you kind of talked about this, but just to put it all together, let's say my dog starts coughing. I think he or she may have this. Earlier, you mentioned as long as they're eating or drinking, you may not necessarily need to rush to the vet. So, if you had to kind of summarize, if you were let's say you and I were on a online vet consult, and I was like, Dr. Jones, my dog is coughing. Like, what do I do? What would you say then?
Well, first, like, I would ask, like, where do you live? Which part of the US? Definitely seems to be the Western states have the highest prevalence, right? So I'd be
Mhm.
like, okay, it might be a bit more worried. Then I'd ask, what's the age of your dog? Is your dog on any other medication, like, say, steroids or something for allergies? Say no. Then is your dog otherwise healthy? No underlying health conditions? Yes or no? Then I'd ask, okay, based on that, like when did the coughing start? Is there been any treatment tried? Yes or no? And if you've tried anything, has it helped? So for instance, one of the remedies I talked about initially, which is one of the basic remedies for any dog that's coughing, but
Sure.
also does work for many of the viruses and bacteria of anything is honey, right? So just local ideal dark unpasteurized honey would be ideal. If Manuka honey seems to have more antibacterial viral properties.
Okay.
And you're sort of like, and you can add other things into it. You can add in something like green tea, for instance. Some people just use honey and lemon, but a standard amount is about a teaspoon or half a teaspoon per 10 pounds twice a day. is a real good symptomatic treatment to start. But for instance, many of the dogs with kennel cough, you do that for a day, and often like 24 to 36 hours later, like there's a dramatic decrease in coughing.
Yeah.
Um, so if you so your dog just starts coughing, and he seems otherwise eating, drinking, still pretty good energy level, and I might ask you if you had a thermometer, take your dog's temperature. What's his temperature? If it's normal, if it's right, I'm always stuck in Celsius here in Canada. If it's
Yeah, you're Fahrenheit
if
here.
he's 38, I say okay, that's 38.5. That's pretty normal.
Okay.
That's about 101.
Okay.
Um, but if it starts to right, so then if you did all that, I say maybe that's okay to wait the next day or two. But once a day, I mean, you're going to make sure you monitor your dog, make sure you keep him away from other dogs, and or he's eating and drinking, continue with something symptomatically for treatment wise. But if there's all of a sudden the coughing is getting worse, not responding to something simple like the honey, and or all of a sudden you start to see a fever and your dog's starting to have less energy, that's when like the alarm bells need to go off, and then you wouldn't want to wait. Then you want to be in seeing your veterinarian. So those are right the general things. Because I've read other things where most of the suggestions have been monitor your dog. Just because you start coughing, you don't have to rush in.
Right.
But some of the specialists who are seeing lots of these cases, I mean, they're seeing so much of it. They're saying your dog's coughing, rush in and see the vet. So, right,
It kind of
there
depends on the area, what the risk, and
it is.
you even mentioned that earlier. Like for people who are ultra concerned, you could call your local vet clinics, a couple of them, and ask like, how many are you seeing with this, and that could help you get an idea of risk
Yes,
in your area.
yeah, that's a great idea, right? To see if it's in your area or not, because then it gives you a much better idea that, okay, odds are, you're just in your area and no one else is sick and your dog hasn't been to a kennel, then most dogs are going to start coughing. Most of them, like regardless, are probably going to have some type of kennel cough as an underlying cause,
Yeah.
like most of the time.
Yeah, it's interesting everything you said. That was my experience. My dog, who we believe had kennel cough, even though she was not around any other dogs. It's very weird, but we did walk in a lot of areas where dogs populate, and we weren't sure if it was the respiratory disease, but she never spiked a fever. So I took bone broth, warmed it up a little bit, put a little manuka
Okay,
honey in there, a little slippery elm. She'd slurp it right up, and
oh,
like
that's
you
perfect.
said, it was like 48 hours, and her coughing diminished quite a bit. Her energy, like it was fine, but it's crazy how that I didn't give her any antibiotics. I'm not anti antibiotics, but I was just wanting to see if she could handle it because she's young and healthy, and it was a non-issue. So I
Okay,
can
and the
attest to
bone
that.
broth, that's a good idea to add that in as you know,
And I just warmed it up a little bit. Just I don't know. I For me, when I have a sore throat, I drink what is that tea? Throat coat tea, and I like
right.
it hot. And I just was like,
Mhm.
maybe she'll enjoy that. And I thought that would help kind of coat. And then slippery elm can help uh, soothe and coat their
100%, it's great. Of all
yeah
the different, works so well for cough.
yeah
You can have it, and it's fairly inexpensive. You can get it in a powder or in the
mhm,
capsules. But just if you're going to treat your dog for coughing, you just want to break the capsules open. So it's better if you mix that powder into that warm water, or the warm if it's going to be bone broth or warm green tea, however. But your honey concoction.
yeah. I think, and then I think I was trying to think of the other things that I've been doing for my dog. So I don't give pre and probiotics every single day, day in day out. I kind of rotate, but I've
Mm,
definitely been making sure that they're getting soil based, species appropriate probiotics, just because we know that gut health is linked to immune health, right?
100%, right?
Yeah,
80% of the immunity is
yeah.
located in the back. Yeah.
Which is why, like you said before, diet is really, really important. So if there is somebody sitting here that's like been on the fence of wanting to slowly transition their dog off of an ultra processed kibble to a fresher food diet, or even going half and half, if the financial means are there, if the ability is there for time, for me, I would say it'd be a great time to start exploring that, because food, I believe, can heal in a lot of ways.
No question.
Yeah.
Great.
Yeah. Are there any other things that you would do for your pets or are doing for your dog to support their immune system. You talked about some of the supplements. We talked about getting outside. Anything else that you can think of?
So I was going to mention the probiotics. Thank you, you mentioned those.
Oh, okay.
Um, and then the only other things I would be mentioning would be if my dog were to have like one of these started to cough and I was okay. For instance, my little dog too. So she starts coughing. I first thing would be the honey, and or I would do the honey and green tea and slippery elm would be probably my three things I would start with. Um, Symptomatically, a day goes by and like okay, she responds in a day. I would treat her that way, just topically or orally, with as if I'm treating a cough.
Mhm.
If the cough progressed, then the next thing I would want to add in some sort of capsule, something that's going to be antibacterial, antiviral, and shown to be potentially helpful against respiratory disease. And I think the one I would most next add in would be quercetin.
Oh, yes.
Right. So it's this flavonoid, this beneficial nutrient that's found in, say, apple peel. It's found in red onion, and it's it was specifically studied as a treatment for COVID-19. So it's got clear antiviral properties, also has
Mhm.
antibacterial properties, pretty safe for our dogs.
Right.
So it's one where, and it seems to be better if you have one that is a whole plant extract. So you're not just giving an isolated chemical compound of quercetin, you're getting parts of a whole plant ingredient. So you've got other things in that plant that are also potentially beneficial for your dog. So, and if you've got one of the bioavailable quercetins, which is a whole plant quercetin extract, it's about 150 milligrams per 50 pounds of body weight, and that can be given up to twice daily. And that's sort of something else that I would add in. If I was going to think of one other thing I'd start her on, that would be it.
Okay.
And I would give her a few days, and then if she responded, great. And if it got progressively worse, that's when the other point to add in is just you don't want to wait till your dog gets to the point where all of a sudden they're having difficulty breathing. You don't want to get there. You want to get your dog into a clinic before it progresses to that stage.
Right. And that actually is a good point you just made me think of. There's a surprisingly there's quite a few pet parents I see, at least in my comments, that they don't have a veterinarian relationship established. So they don't necessarily
Right.
go once or twice a year. So that would actually be another tip I just thought of, which is if you don't currently have a relationship with a veterinarian, start researching just so you know like who's in the area. I know where I'm at. I'm in a sort of smaller town, but there's still probably 8 to 10 vet clinics here. When I moved here a year and a half ago, it took a long time to find a veterinarian that had openings for me. And so that's just something, especially with dogs, getting sicker right now. And I'm sure people are going to the vet more and more to start
Mhm.
looking for a vet near you that's accepting new clients. If you haven't been to the vet in the past year, for me, I take my dogs every 6 months, which might be excessive to some just for checkups and looking at their teeth. But even once a year physicals, I personally think is really important. So if you haven't had your dog in, might be a good time to do that because I know that for me, now that I have this relationship established, when my dog got what we now suspect to be kennel cough, maybe the respiratory disease, probably not. It was really easy to call. They got me in right away. She was, even willing to give antibiotics if I felt the need for it without even going in because we had recently seen her. So that's something I would consider.
A good suggestion. It is, and the community where I live, for instance, there's 3 clinics, and
Oh,
there's
yeah.
huge waiting lists for people to get in.
Yeah, it's kind of scary. A couple other things I was thinking is I saw somebody ask about like some food toppers. For me, if I had to pick like just a few whole food toppers, if I was feeding a kibble, probably the ones I would personally go with, and I'd love to hear yours, would be wild wild blueberries if you can, or blueberries. I think they're pretty readily available. You can usually find them in the frozen section. Really high in antioxidants, and wild blueberries have like twice as much. Dark leafy greens like a spinach, I would just make sure to like steam it or mince it, or even like broccoli's great. I think broccoli is one of the most nutrient dense foods, but if you could do broccoli sprouts, the reason I like sprouts is especially for picky dogs. I was reading that they have, I think it's 100 times or 50 times more sulforaphane, which is the component that makes it antioxidant, protect against free radicals, and anti-inflammatory. So there's like 100 times the amount in like this much of broccoli sprouts than what you would find in a huge bushel of
Oh,
broccoli. So you could feed just a little bit of the sprouts. They're more potent is the net of that. So for me, those are some of the ones I would focus on one at a time. What are some like whole food options that you would add if you could?
that's a good suggestion. Is I like the sprout idea. So for instance, with her my own tool, I'll add in. I use a lot of flax and a lot of ground
Yep,
flax. In part, she needs some of the extra fiber, but it's a really good source of the essential fatty acids.
true.
So you're just adding in additional essential fatty acids. Secondarily, she's a big fan of yogurt.
Ooh,
So
me too.
right, so it also and so it's a whole fat yogurt. She can tolerate the milk fine,
Yeah,
and but it's just all that good it's that good bacteria because that's so key to having a good strong immune system. And the other thing I'll often do is just anything else additional to potentially help increase her quality of the animal protein. So I'm often
mm,
adding in an egg, light cook it. Um, but at the very least, whether she's sick or not, just keeping her healthy. I just know that if I can increase the quality of her protein, it's going to potentially decrease the chance of her getting sick in the first place. So they're the ones that I commonly add. But if it was, Rachel, if it was really there was respiratory disease, I probably, I might modify some of the things. I might start looking what as you suggested, increasing the antioxidants. For instance, some of those other nutrients, they're be more focused directly on the immune system. And I think that's when you talked about blueberries, you talked about right, concentrated a concentrated grain. I think they're a great idea.
yeah. And I'm getting some questions in here about quercetin. You actually have your own quercetin that you formulate on your website, correct?
We
I
do.
remember.
Yeah.
Okay. So yeah, drjonesnaturalpet.com. And it's also linked in the description below. So, and you have quite a few really awesome supplements. You have a lot of
Thanks.
resources. You do webinars. So you have
We do.
a
Thanks.
lot of content for pet parents. Somebody in here even said that your shorts, so your TikToks and your Instagram reels are just like a godsend. So
Okay.
I love seeing that. But no, I think this has been, a good summary. I'm still seeing questions about, oh, actually one more question is what about puppies? Are we more concerned, less concerned, anything different with puppies?
So I haven't seen any case reports of puppies being affected.
Okay.
But part of it, there isn't one area that's compiling all the data, so we're not able to see like here's all the animals affected because there isn't one central database.
Mhm.
I would think as a puppy, you potentially would be at a higher risk in terms of like these guys just have a developing immune system. Um, so if I were to have a puppy, I would definitely be more concerned than I would, right, kind of a 2-year-old dog.
Yeah.
So
Okay.
I think it's just a good time to be more cautious. You want your puppy to socialize, I get that, but right now I'm like, you don't want them to have to deal with pneumonia.
Yeah, because you were even saying before we got on, and maybe even earlier, that some of the sicker dogs have been younger as well, correct?
Yeah. And that was probably, I think, when the first sort of alarm bells came off. That's exactly what it was. It's you seldom ever, and I'm trying to think back in practice. We had a few different outbreaks, which were diagnosed at kennel cough at the time, and a few dogs, like one or two, would then go on to develop pneumonia. But even those dogs that develop pneumonia secondary to kennel cough, so typically more often it's a bacterial pneumonia, they would respond pretty quickly to antibiotics. We never had to have a dog that was on oxygen and or having to acquire like a nebulizer or where you have to do the thing called capage where you're trying to move because what's happening you get all these secretions building up in the airways and you're trying to dislodge those secretions. So um, whereas that's what's happened. So many of the clinics have had to do that. They've had to get these
Mhm.
dogs on oxygen, get them right, having to do capage, break up right all the mucus secretions in the lungs.
Yeah. And speaking of that, Tiffany says, what are your thoughts on breathing treatments via nebulizers, vaporizers? One thing I learned through all this, just reading about everything, is that you can you tell me if this is accurate, but you can do an at home nebulizer where you just take your dog into the bathroom, shut the door, and then you have the shower on hot. And you
Yeah,
don't put them in it, but the steam
the
can,
steam.
or even a
Yeah,
humidifier can help. Are those things that
yeah.
might be helpful as well?
So the idea of the steam therapy that way is that you're breathing in that warm, moist air, and then that'll actually, in some cases, help decrease irritation in the airway. So they might cough a bit less, but also sometimes helps break up
Mm,
some of those secretions that are in the airway. That warm, moist air will help break it up because that's you want them to cough and cough that out, especially when it's progressing to bronchitis or pneumonia. And there also are now even companies are making these type of a face mask where that attach to your dog, so you can actually some of the veterinary medications are given in to help dilate the airways,
mm.
and that's how you have to deliver them via. They have to get their way into the lungs to be effective. Um,
Okay. And what about humidifiers? Do we think those are beneficial?
Especially in a small, for sure, because that's similar to the idea, but you get into a slightly closed space, like you said, the bathroom or something,
Yeah.
and then crank up that, and especially if you can have it as slightly warm air, seems to be more beneficial.
Okay. And have we, just a couple last questions, have we seen this in cats? Somebody was asking if we're seeing this in
No, but
cats.
I mean, for instance, of all the different cat diseases, this upper respiratory tract infections are the most common things cats get. But there's herpes, there's calicivirus, and there's herpes virus, and then there's mycoplasma and other organisms that cause feline upper respiratory tract disease. So
Mm,
it's incredibly common in cats, but it's its own specific cat condition.
okay. That's fantastic. This has been really helpful. I think the summary of all of this is that, again, we're not going to panic, but we are going to stay aware. We're going to take as many precautions as we can and control the controllable and really work on supporting our pets' immune systems and really avoiding this nose to nose interactions with other dogs. And I know that not everybody here can avoid the groomers or boarding, but I think when at all possible, it sounds like the best is to avoid when we can. And then if we can't, you made some great points earlier to ask questions of those facilities to make sure that they have a lot of air circulatory circulation and that they're isolating animals that are symptomatic. So I think this is fantastic. For everyone watching, please make sure you follow, subscribe to Dr. Jones. All of his information, his website, his socials, will be linked in the description below, or you can just find him at Veterinary Secrets on all social platforms or drjonesnaturalpet.com. Like I said, he has webinars. He has thousands of hours at this point, I'm sure, of free content
Yeah.
just supporting pet parents. And we are so grateful that you're out there doing what you're doing, going against the grain and making this important information so accessible to all of us. So thank you for being here
Oh,
today.
thank you.
Absolutely. All right, with that, we're going to end the stream. Make sure, again, that you guys are sharing this live on all your social platforms so that you can help your friends.